Hello everyone, glad to see you again. In last lesson, we have learned general introduction of prescription. For a prescription, it may contain composition, modification, and the methods of decocting drugs, which will affect the therapeutic effects of the prescription definitely. From now on, we began our study of specific discussion of prescription. Today, we are going to learn prescription for relieving exterior syndromes. Prescriptions are mainly composed of diaphragmatics and can induce diaphoresis, expelling pathogenic factors from muscles and skin, promote eruptions, and be used to treat exterior syndromes. Belongs to prescriptions for relieving exterior syndromes. Since exterior syndromes cover two types, namely one cold type and one heat type. Prescriptions for relieving exterior syndromes are divided into prescriptions for relieving exterior syndrome with pungent warm drugs, and those for relieving exterior syndrome with pungent cold drugs accordingly. The former mainly contains drugs with pungent flavor and warm property for relieving exterior syndrome. It's capable of expelling wind and cold, and applicable to exterior syndrome due to wind cold, marked by aversion to cold, fever, general aching, dyspnea, thin and whitish tongue fur, and superficial and tense pulse. While the later, prescriptions for relieving exterior syndrome with pungent and cool drugs are capable of dispelling wind and removing heat. It's applicable to exterior syndrome caused by wind heat, marked by cough, mild, feverish body, slack thirst, and red tip tongue, superficial and rapid pulse. It is applicable to common cold, flu, acute bronchitis, and acute tonsillitis with the above symptoms and belonging to exterior syndrome due to wind heat. Here are some notes. Functions of prescriptions for relieving exterior syndromes are inducing diaphoresis, expelling pathogenic factors from muscles and skin, promoting eruptions. Second, this kind of prescriptions cannot be decocted for a long time in order to prevent the drug property from dissipating. Third, the patient should be taken warm decoction and pay attention to keeping warm. After the brief introduction of prescription for relieving exterior syndrome, now let's talk about specific prescriptions. Prescription for relieving exterior syndromes with pungent flavor and warm property. The representative one is Ma Huang Tang. Ma Huang Tang, it comes from Shang Han Luan, treatise on exogenous febrile disease. It composed of Ma Huang 9 grams, 桂枝 6 grams, 杏仁 9 grams, 炙甘草 3 grams. Functions of Ma Huang Tang are inducing perspiration to relieve exterior pathogenic factors, dispersing the lung to relieve asthma. This recipe is for exterior excess syndrome due to exogenous wind cold, marked by aversion to cold, fever, headache, general itching, dyspnea without perspiration, thin and whitish tongue fur, and superficial and tense pulse. It's applicable to common cold, flu, acute bronchitis, bronchial asthma, and other diseases which chiefly manifested as aversion to cold without perspiration, cough, and dyspnea. If the syndromes are accompanied by pathogenic dampness marked by arthralgia, heaviness of the body, add Baijiu to eliminate dampness, thus making a new one entitled 麻黄加竹汤. The syndrome is due to attack of wind cold on the exterior, obstruction of defensive qi, stagnation of interstitial space, and failure of pulmonary qi to disperse. It should be treated by inducing perspiration to expel pathogenic factors from the exterior and dispersing the lung to relieve asthma. In this recipe, ingredient 麻黄 acts as the monarch drug. It is capable of inducing sweating to dispel exogenous pathogenic factors and dispersing the lung to relieve asthma. Ingredient 桂枝 as the minister drug is capable of dispersing pathogenic cold by warming the meridians. 杏仁 is capable of relieving stagnant lung qi, serving as adjuvant drug to enhance the effect of relieving cough and asthma by combining with 麻黄. The last ingredient serves as the guiding drug, capable of mediating drug properties and invigorating qi and enriching mid-energizer, so as to prevent ingredients 麻黄 and 桂枝 from inducing excessive sweating to impair the vital qi. Administration: decoct the above drugs in water for oral use. The recipe is contraindicated for the exterior syndrome due to wind cold with sweating because it is drastic in inducing sweating. So, patients with iron deficiency, blood deficiency, and serious interior heat should use it with great caution. That's all for today. See you next time.